Hello there, it's Dr. Tyra here, and I'm here once again to teach you what you need to know about anesthesia. Now, do you know that if you're coming for surgery, you're not supposed to eat? Yes, especially if you're going to have a general anesthetic or you're going to be sedated. Now, what happens when we eat is that the food stays in our stomach for about 2 to 4 hours before it is moved out. Then the stomach digestion starts to take place. Now, if you come to the hospital for surgery after having eaten, you are what we refer to as a full stomach. Now, this is dangerous because when you're awake, your body is able to control those reflexes that will prevent you from vomiting and bringing up the food you've eaten. But when you're under anesthesia, what happens is that your body cannot control these reflexes, and there's a tendency for this food to come up, what we call regurgitation, and then it may come up and you either vomit it or you can aspirate it. Aspiration means the food goes into the lungs, and this is very harmful for the patient. Perioperative fast is important such that it reduces the contents of the stomach and reduces the risk of regurgitation and aspiration. So, if you're not supposed to eat before coming for surgery, how long should one fast before coming for surgery? I'll tell you. For solids, for your swallows and your rice and your yam, those kinds of food, if you've eaten them, you're supposed to fast for 6 to 8 hours. This will give enough time for the food to be digested. Then for younger children, for toddlers, for babies, they should be allowed to eat up to 4 hours before the surgery. What I mean is that if the surgery is going to be by 8 a.m., the child should stop eating from 4 a.m. And then it's advocated through the latest guidelines that both adults and children should be able to allowed to take fluids up to 2 hours before the time of the surgery. When clear fluids like water and some juices that don't contain particles are encouraged to be taken. So please do not forget, you're not supposed to eat before surgeries. Ask your doctors questions before you come for your surgery to ensure your safety.